Welcome to The Explainer. Today we're diving into a really puzzling muscle disease, a rare and complex condition. We're going to piece together all the clues, from the very first symptoms to diagnosis and management, all in one clear story.
So, what if your muscles just started to weaken? For no obvious reason. Imagine you're finding it harder to grip your coffee mug in the morning, or even just turn a doorknob. Or maybe standing up from your favorite chair suddenly feels like a real workout, and you're tripping more often. But the weirdest part, the cause, is a total mystery.
Well, for some people, this is a reality. We're talking about a condition that affects maybe 5 to 9 people out of every million. Now, that might not sound like a lot, but that rarity is exactly why it's so often underdiagnosed. It can take years, literally years, to get the right answer.
The name of this disease is sporadic inclusion body myositis, or thankfully SIBM for short, and that's what we're tackling today. We're going to follow the entire journey, right from those first confusing symptoms through the whole diagnostic process, and finally into what it means to manage it.
Okay, so let's get into the nitty-gritty. We'll start with the first clues. While the first symptoms can feel kind of random and vague, ISBM actually leaves behind a very specific fingerprint. It's this unique signature that helps doctors tell it apart from other muscle conditions.
And here's the absolute key. It's a really strange combination of weaknesses. On one hand, you've got the quadriceps, those big muscles at the front of your thigh, getting weak. And at the same time, the muscles that let you bend your fingers, your finger flexors, are also getting weaker. Now that specific combo, that's the telltale sign. You just don't see that pattern in many other diseases, which makes it a huge clue for doctors.
But it's not just that unique weakness pattern. Doctors are also on the lookout for other signs. For example, you might see visible muscle wasting, or what doctors call atrophy, especially in the forearms and thighs. And then there's difficulty swallowing, or dysphagia. That's super common, and sometimes it can be the very first thing a person notices.
Okay, so you're probably wondering, what's actually happening inside the muscle to cause all this? Well, this is where it gets really fascinating. You can think of SIBM as a complex battle being fought on 2 different fronts at the exact same time.
This really is the central conflict of the disease. On one side, you have this inflammatory attack. The body's own immune system gets confused and sends its T cells to invade the muscle fibers. But at the same time, there's a totally different problem, a degenerative process. You've got these misfolded proteins building up, kind of like gunk in the gears, causing the muscle cells to basically crumble from the inside out.
And this leads to the biggest puzzle of all. You'd think, okay, there's inflammation, so let's hit it with anti-inflammatory drugs, right? Well, with SIGM, that doesn't work. The powerful drugs that help with similar diseases just don't have an effect here. And that sparked this huge debate in the medical community. Is the inflammation the real cause of the damage, or is it just the body's reaction to that other degenerative process? It's a real chicken or the egg situation that researchers are still trying to figure out.
So all this complexity really leads us to the next part of the story, the diagnosis. Because this condition is so rare and has these 2 different things happening at once, figuring it out is a lot like a detective story. Doctors have to piece together clues from a whole bunch of different tests to finally crack the case.
So, the investigation kicks off with a physical exam, where the doctor is looking for that signature pattern of weakness we talked about. Next up, they'll likely do blood tests to hunt for a very specific autoantibody, basically a rogue protein that shows the immune system is attacking itself. Then, an MRI can give a clearer picture, revealing a distinct pattern of damage in the muscles. But the real smoking gun, the definitive proof, comes from a muscle biopsy. That's where a specialist can look at the muscle tissue under a microscope and literally see both the invading immune cells and those clumps of degenerative protein.
All right, so once that diagnosis is locked in, everything changes. The focus makes a complete 180. It's no longer about a whodunit mystery. It's about shifting gears to find the best way to live with the condition and, crucially, maintain function for as long as humanly possible.
Now, this next part can be a really tough pill to swallow for patients because, like we said, the standard treatments that you might expect, things like steroids or immunosuppressants, they just don't work here. But, and this is a big but, that reality forces a shift in focus to a completely different and, in its own way, very powerful approach to managing the disease.
So, the goal here isn't a cure, at least not right now. Instead, it's all about a proactive strategy. The absolute cornerstone of that strategy is rehabilitation. Think of it as a way to fight back, to slow down the disease's progression, maintain strength, and really preserve your quality of life.
But here's the kicker. Despite how important it is, rehabilitation is just critically underused. Get this. A big study found that a staggering 71% of patients get no rehab services at all. The very tools that are the most effective are the ones being used the least.
And this is exactly why that number matters so much. Let's break it down. Physical therapy, that's about using tailored exercise, which is proven to be safe and effective for building strength. Occupational therapy, that gives you clever adaptive tools and strategies to handle daily tasks when your grip is weak. And speech therapy, this one is absolutely crucial for managing those swallowing difficulties to make sure you're getting proper nutrition. These are the best tools in the toolbox, and yet there's this massive gap in getting them to the people who need the most.
And all of this leaves us with one final and, I think, hopeful question. Right now, there's new research, new trials that are finally targeting both sides of the disease at once, the inflammation and the degeneration. So the question is, will this finally be the breakthrough we need? Could this puzzling disease one day move out of the mystery file and into the solvable problem file? That's the hope on the horizon for everyone living with SIBM.